It's open.
Okay,
it says we are streaming. Oh, I hope we have a lot of men today. And I hope we have a lot of women who love the men that we're going to be talking about, because hormones affect everybody. Let me get I'm wondering if we are live now before I get started. I know we'll probably be recorded.
You are definitely live.
We are live, and I am so excited. We are on Facebook and YouTube live. And so today I want to call upon all of you who have men in your lives. Men, I hope you join in and tell your significant others or the women in your life to tune in, because we are going to talk about hormones, male hormones, the good, the bad, the ugly. So fasten your seatbelts. It's time to dance, because we're going to learn and grow together. Here we go. Ready, Lisa?
Ready.
The Lillian McDermott Show.
We love, we fear, bridges we burn, we make mistakes, then we live and learn. When life gets tough, and it seems like your best ain't good enough. If you're in need of hope, you know where I'll be right here. Right here. And when you need a friend, you can count on me. I'll be right here waiting for
you. This is the place you can always turn to when you need a friend. The Lillian McDermott Show. To reach out to Lillian, visit her on the web at whenyouneedafriend.com. Now let's all learn together. Here's Lillian McDermott.
Hello, my listening and viewing friends. It's so nice we can meet each other on the air on this beautiful, best day ever. And for those of you who tune in to the classroom, I am so glad that you are here. If this is the first time that you're tuning in, please know I've been waiting for you. This is a safe place where you can go to when you need a friend. It is my commitment to provide alternative ways to heal, and it is my mission to make awareness, responsibility, and truth a part of our everyday life. And I hope you, my listening, as well as my viewing friends live or later on in BitChute or later on podcast, will feel empowered to embrace a new truth and live the life of your dreams. Now, there's so many of us that are going around feeling incomplete. You know, just yesterday I had a deposition where, you know, when they ask you questions, you focus on what's going on for that issue. But the reality is there's more than that issue. There's life that's happening around us. And it doesn't matter how you feel. It is still important for you to be a part of this life, to be substantial. Whether you're happy or sad, it's still so important to dance. And people ask me, why do you dance before you get started in the classroom? Because it changes our mood, because it allows us to shift. And it doesn't matter how you feel at that moment, the energy that is shifted within you from maybe a horrible situation to a great situation. So I just want to start with that today, because we're going to talk about male hormones. There are a lot of men out in this world that are feeling less than. There's a lot of women too, but we already talked about that 2 months ago. You can check out the conversation with Lisa and Tina Guarino. But today, what we're going to focus on specifically is men. Men, we love you. We love you, love you, love you. And we want to see you at optimal health as well. That includes hormones that are often neglected. And who else but Lisa Geyer of Live Longer Medical to bring us the latest and the greatest information on male hormones, or the male body, the good, the bad, the ugly. And since it is our sole purpose in life to give and receive love and knowledge, I am grateful that my friend Lisa Geyer is here to do just that. Welcome, Lisa, to the classroom. Oh, you're muted. Uh-oh, what did you do?
Okay, happy to be here.
How did you do that? How did you this? Okay, inside scoop. For those of you who are watching, you get to have the inside scoop. Well, Lisa and I spent 15 minutes trying to hook her up, and everything was perfect right before we started dancing. So things happen in life, doesn't it, Lisa?
Yes.
This is a perfect example that you might plan on a perfectly healthy life, but something beyond your control may just cause you to tweak what you thought needed to happen, tweak it and still work with it. And that's part of dealing with hormones, right?
Exactly.
What a perfect example. Thank you.
I'm telling you, it fits right in.
Perfectly designed. Thank you.
Yes, yes. So, I was thinking about this morning. I've seen over 100,000 patients in 20 years. I've heard so many stories. And the last thing we as women want are grumpy men, grumpy old men. We don't want that. Grumpy young men. We don't want that either. So I think it's really important to slow men down, the men in our lives, and men that are listening. They really need to take time to understand their unique hormonal biochemistry because, andropause, testosterone, whatever you want to call it, men have it just like women do. It's a menopause. It's funny that we call women menopause and men have a different name, but at any rate, it's similar. The symptoms are very similar. And, in the practice I own now, we have young men on testosterone replacement therapy. And there are so many options. There are so many ways to look at it. We have so much to cover today. But, who wants, a man that's just grumpy and doesn't feel good and can't work out? Men decline after 30, or they've even had instances where men who've been hit in the head and they mess with their pituitary and it adjusts how their body processes, methylates, uses testosterone. So, that's kind of an issue to think about too. And so, we've got young men in our practice who are on pretty high dose hormone replacement therapy. And it's odd, but you need to address it because otherwise you've got other issues.
Wow, you said something very powerful here, Lisa, and I've got to go back and explore it. You said that men that get hit in the head, or people that, or
They've
men,
had, yes.
tell us more about that study because that was very curious. We have a lot of young men, and I had Dr. Bennett Omalu talk about concussion and the injuries of the brain that could happen. So can a hit in the head from football or a ball hitting them on the head? I mean, we are team-driven society, win, win, win. And so getting hit in the head could cause a pituitary response?
Well, it depends on the person. I wouldn't say, I don't know what the percentage is of how often that happens. I don't really know, but I know that there have been cases where that's been an issue and it's something that's being explored. So, if you are someone that's been in a car, you could be in a car accident, you could be, play football, softball, you could get hit with a ball. I mean, who knows? It's just any kind of injury to the head, it's worth exploring. But, people have said to me, gee, when should I check my testosterone level? For women, it's important too, but men, it's the driving force. It is the driving force for men. And, it will change so much for a man in their biochemistry, their bone density. It changes their bone density. It does in women too. We see women that fall, break their hip, they have bone issues. There's a lot to look at, but testosterone is important for women as well. But men have the same issue. It does affect their bone density, their energy, whether they're grumpy, their mood. And, for women, when you start to see this in your husband and they're over 30, have them go in and get all of that checked. And, you want to make sure that they're checking a nice full panel, and do a really good exploration of their testosterone levels. But, men will have, we had actually this last week, we had 3 couples that came in and literally the women were dragging their husbands in to have their testosterone checked because they their husbands lost sex drive was just very plummet. They had a plummet in their sex drive. They had no energy. They weren't working out, and they were gaining weight. Men get that belly fat. So it's, when you start to see some of those symptoms, start looking. Take the time to stop and figure it out.
That's great advice, because many times, that becomes the elephant in the room. And I've said this, and we've talked about this in the classroom before, that sometimes we don't want to deal with the discomfort of the discussion, but we carry it with us in our body and we drag it around like a 10-pound, 50-pound stack of potatoes or bag of potatoes. And so that becomes like people start developing walls. Now let's watch television till we fall asleep. Let's ignore, avoid. Next thing you know, they're going to a marriage counselor. If they even want to attempt to work at the marriage, sometimes they go outside the marriage. Sometimes they just go straight for divorce. So it's sad that something so simple as a discussion. And I don't know if you have these discussions with them or have had to have discussions like this to talk to the women to how to bring up a topic like this with their spouses. And, I would think that I would say, I want to have more sex with you. What can we do to make this happen? Or maybe it's not about the sex. Maybe it's about lack of intimacy, because testosterone also causes a lack of focus. Okay, so let's talk about some of the symptoms other than dragging. I mean, is there anything that that's more, you see the external? Is there an external, like you can look at someone and go, whoop, low testosterone, or is it an internal thing?
Honestly, some of the biggest symptoms that I see when a patient comes in are they have a lack of energy. They have no motivation. That's a huge one for men. No interest in sex, or they have, difficulties with erection. That's a big issue for men. And we've been addressing that in our practice. We have Tina Guarino that just joined us, and she's just an amazing expert on fixing that issue. And it is personalized, because you can't just say, I'm going to give you testosterone, we're going to fix that level, and immediately you're going to have a huge turnaround. Mm-hmm. I tell every single patient, even Monday, we had several women coming in for their hormones, and I said, you need to give this 6 months. We are not like driving through a fast food restaurant. It is not a quick fix. It is not one size fits all. And I really don't believe in that kind of medicine, because I think you miss things, and I think that you're not being respectful of the patient. So I think when you address hormones, you have to look at lots of different issues. And Tina has been an amazing partner in our practice, because she really knows how to put that puzzle together. And, there's so much to look at, but for a man, if the testosterone level is not appropriately managed and dosed, they can have a myriad of issues. We've even had some men, which we can go into later, but they're maybe not taking the right form of testosterone. We can talk about that in a bit. But, as far as the big issues, when I see a man that's got, abdominal, they've got a lot of weight going on there, they've got the big belly, and they don't have the energy, and their wife is nudging them, with their elbow saying, look, you have no sex drive. And how cool that, a woman has their sex drive intact, that, having to drag their husbands in. What a great thing.
Until their husbands get fixed and they're like, oh, well, I need some testosterone too.
I'm going to have to get a boost.
Win-win.
Yeah. Well, I'm a single girl right now. I keep mine down. I like paying my dose. But, it's all about stamina too. It's, you want, a man in their 20s. If a man looks back and they say, what was I like in my 20s? They tend to long for that. They want to be that way, the way they were in their 20s, with the energy, with the ability to focus, with the ability to, run 5 miles a day or cycle 30 miles or whatever it is. And then, sometimes we become accustomed to our bad patterns, or we become used to having joint pain when we get up in the morning. We just think that that's the way it should be, or we become accustomed to feeling low every day. And no, that's not how we're made to be. You know, we are an amazing temple that God created to be energetic and vibrant and to live a long, vivacious life, not to live suboptimally. And I think one of the things is the word optimal, because many traditional practices, when you go in, you know, the range for testosterone can be 250 to 1,000. And you could be at 253 and they're saying, you're in normal range. And yeah, you got the belly fat, and yeah, you don't feel great, but you know, your testosterone's fine. No, I don't think so. You know, we have to be good practitioners and listen to our patients and give them some wisdom and some other ways of looking at the lab testing. You know, when you're in your 20s, you know, your testosterone level is going to be 800 to 1,000. So taking that into consideration, what can you do to boost that as we're losing the ability to process our testosterone properly? And why is that? You know, people will say to me, you know, why? You know, why am I aging? Well, we're all aging for a number of reasons. Look at our exposures. You know, what did we do in our youth? You know, we've had patients that, you know, they smoked a lot of marijuana. That will burn off testosterone real fast.
Really?
So it's vitally important that if you have a history of that you seek someone who's going to look at your biochemistry. And I know we're focusing on testosterone, but literally, if you're a patient in our practice, we're looking at a lot of things. And even this last week, Amanda Nolte is also just an expert in hormones in our practice. And she and I were talking, should we just have a fast track hormone, you know, let patients come in and do their hormones? And, you know, we just didn't feel that we could actually do it that way. We can't have a 15-minute visit and actually give a patient what they need. So for those of you out there that don't live in our area and you're looking for a practitioner, it's really important you find somebody who's going to look at, you know, the total of who you are and take the time to make testosterone a valuable piece, especially if you're a man. It's important for women too, but you know, we're talking about men today. And you know, I think we want, as women, as a woman, I want a man who, you know, is vibrant and energetic and, you know, ready to keep living life and have that vitality to keep living that way. Not want to sleep on the sofa and watch movies all night.
Yeah.
Come on.
Well, you know, people, it's interesting. Sometimes we need to make ourselves get out of our comfort zone. Like I said at the beginning, it doesn't matter how you feel. You got to get out of that and focus on what you want. If what you want is a vibrant life, then you must start thinking how, you know, vibrant thoughts, and then you feel it and then you act upon it. So,
Right.
you know, earlier in the, and when we first started, you mentioned something called andropause. And then you called testosterone,
Testropause. I've heard
testropause.
there's
Okay.
like a million different phrases.
So what exactly is andropause? Is that low testosterone?
It's low testosterone. It could be low DHEA too. DHEA is an anti-aging hormone that will push our testosterone up a little bit. I personally take testosterone with DHEA because they're both vitally important, but they're really good for a man too. And, you know, again, there's so many different ways to treat men for a testosterone deficiency. There are injectables, and it's a cypionate, and it's a wonderful little boost. Whether you should be on that every week, I don't know. It's really patient-driven and patient-specific. There are types of cypionate that are combined with DHEA. That might be a better option. There might be things like a cream, if men are comfortable using a cream every day. The good thing about a cream is that you're dosing it and you're getting it every day, and there's some consistency there. We preach bioidentical. That's it's our preference.
And let's break down bioidentical, because there's a lot of synthetic hormones out there.
Yeah.
What makes something bioidentical, and what does that mean?
Well, it is made in the lab, but it comes from soy or yam. So it is more, and again, I'm not a biochemist, so I know there are probably MDs and DOs and practitioners, nurse practitioners out there that could probably be more well-versed in this, but they are from yam and soy extracts. They are made most like what your body recognizes. So they are usable and there's not a negative side effect. Sometimes with cypionate, which is an injectable, we see polycythemia, which is an increase in the red blood cells, excuse me, and it can make thick blood. So that's not good. And so you don't want to have a lot of that. And we have to have patients go donate blood to reduce that. So there are things you have to really watch, and you need to be working with a practitioner that cares enough to say, hey, you're doing this too much. We might need to find another method. Mm-hmm. So, there's, you just really, you just need to find a practitioner that's well-versed in bioidentical hormone replacement therapy. Pellets are awesome. They have really perfected pellet therapy now, and we do a lot of pellets in our office, and men especially love it. You put them in 2-3 times a year, don't have to think about it. It's slow releases. It is a tiny insertion in the hip, and it's a pretty simple procedure. Really takes about 10 minutes. So if you can manage that twice a year, I think from a financial perspective too, it's economical, and it's safer. So, there's an amazing physician, a Harvard, he's in the urology department, Morgenthau, I got his name right, Morgenthaler, I think is his name. And, he has been a part of many studies using testosterone. And I think there were at least 18 that he references. And, I've heard people say, well, gee, if you start testosterone therapy, could you be opening yourself up to prostate issues? We always check a PSA because you need to know. But he says no, that there are no studies to prove that it could cause or worsen prostate cancers or inflammation or any of those prostate issues. So, if you are someone that's study driven, I would look him up and look at some of the studies that he's done.
What's his name?
Morgenthaler, and he's a Harvard professor. And I think he's in the urology department, if I recall.
I find it interesting. There's a lot of people that say there are no studies for vitamin C that says that vitamin C can help the body restore the body from cancer. That there's no studies, and I'm like, but they are.
But there are.
And so I know that there are studies that say that testosterone, too high testosterone, could be causing prostate issues. And then there's studies that say there's no causation, there's no link between testosterone and the prostate. It's so hard to, and then the people who believe one way or the other, you got that two sides, have the exact same passion. Oh, there are no studies. Nobody's acknowledging the other studies.
Well, and the issue is a balance of information and knowledge and personalizing it to you. I mean, have you had heavy metals? How could that affect how you process testosterone? Do you have other issues that could be, cancer oriented or causing cancer in your life? I mean, you really have to take the time to know your biochemistry and do a very, very, very wide look at your biochemistry. I think that's vitally important. I know that I heard the other day, out of the blue, someone, and I love Suzanne Summers, she was giving an explanation, I love her explanations, of the prostate and how it inflames over time. And that, the prostate, when a man is young, is small. And as they lose testosterone, it begins to get inflamed because it needs the testosterone to be healthy. So, that was her explanation, and it makes sense.
Yeah,
pretty logical.
Yeah, I'm in. But then there's somebody else that says, well, with the same passion. So it's like, where do you go for the right source? Who do you trust? And I would say, let's be our own MD. Yeah. And if we're trying something and we have a response, like one size does not fit all. Maybe for some men it works, and for some men it doesn't work, because now we're looking at past traumas, we're looking at metals, we're looking at environmentals, we're looking at emotional, we're looking at, lifestyle, how do they eat?
Right.
I mean, there's so much. So there is a bit of, there is a bit of like, okay, we're always talking about looking for the root cause, right, Lisa? It's
Right.
all about trying to find the root cause. But when it comes to replacement therapy, is this a long-term thing? Or with you, I hear you say that even if you go on these replacement therapies, that it's very important to look for the root cause so you can start tweaking that too.
Right. I think you do. You have to find out if there's a root cause you don't know about, because, I hear of clinics where everybody that goes in gets pelleted, or everybody that goes in gets chelated. I think that again, they're trying to provide a more progressive, cutting edge treatment, but it's not one size fits all, like you said, and it needs to be personalized to that person. And you have to look at the whole picture. Yes, we are what we eat. You can't have, a horrible, abysmal diet and expect to have energy.
Yeah.
Certainly testosterone can be a piece of it, but what we feed this one temple God gave us is vitally important to how we're going to get up in the morning and function in our day. And, we are all hit with the pressures of life and the stressors of life, and we have to deal with that too. So, and how we're able to do all of these things that we need to do in life are critically important. Another thing for men is weight loss. So we have a lot of men that come to us and, they just can't get the weight off. And certainly we look at testosterone, but what about their thyroid? Who's looking at their thyroid as well? And again, you have to be well-rounded. You have to find a practitioner that's going to take the time to, help you do that. I've had people who have called our clinic and they don't live anywhere near us. And I help them find a practitioner in their area because, you really need somebody that you can lean on and work with. We're doing telemedicine now. So we have a lot of patients actually calling from out of state. So it is possible. We had a California patient actually yesterday that we're taking care of. So, it's
Wonderful.
You can find someone to connect to and you can find a way to do it, but find that person that's going to resonate with you and also work with you as a team player and not be a dictator, because medicine, we have to work as a team and everybody has to feel a part of what they're doing and they have to feel comfortable with it.
I love that. I love that. Okay. So I've got some follow-up questions for you.
Okay.
Because you have mentioned so much. First of all, you talked about the right form. Is that bioidentical versus synthetic? Is that what the form is, what you were talking about?
There's so many ways to treat low testosterone in men and women. But for men, sometimes if they come in and they are so low and they're just having so many issues, a shot of cypionate for a time might be a good idea. That is synthetic. There's a history of weightlifters using it. There's a history of abuse, and we're very careful about that in our practice. We do not tolerate that. We've actually had, patients leave because they want their injectable cypionate, and we don't feel it's the best for them, and we don't want to be a part of creating ill health in someone. So, we've had that happen, but we're going to stay true to what we do and take care of people to the best of our ability, regardless. But, that's one form. And sometimes, a time of using the cypionate might be the best idea, but that is synthetic. And, we still feel the very best is bioidentical, whether you get it in the form of a cream, whether you get it in a pellet, or an oral supplement. This could start a whole another hour, but peptides is just another thing.
You must have read my mind. I was going to ask you about peptides.
There are some that are new, and I can't even remember the names of them, so I apologize in the moment. There are some new ones that just came out, and my good friend Linda Haynes, she is amazing with peptides, and she's in Indiana. She's one of the very, very few that have been selected to make and create peptides, and you have to be accredited, and she's careful to use the ones that are appropriate and approved, and she has all of her documentation for it. So I'm super picky about them. If I'm going to recommend that, peptides to someone, it's going to be from the best source. But at any rate, yes, there are peptides. There are some anti-aging peptides that can really help us keep things in balance, whether it's mood, our hormones, our IGF-1, which is another part of our hormones, insulin growth factor. And that, tells us where we are with our, how our anti-aging hormones are looking. I'm actually having mine checked this week or next week, just to know where I am, where that level is. It just kind of helps to look at that and then find out what I need to do to maybe boost that a bit if I need to. Yeah. So, it's, I don't know if I answered your question, but yeah, there's just so many things that you can do to help with hormones, and it varies from person to person what works.
Okay. So more follow-up questions, because, we want to differentiate between synthetic and bioidentical. And you had mentioned that you could have two forms of bioidentical, one soy and one yam. But we also know that soy is highly GMO. It's been altered. So is this soy non-GMO bioidentical?
You have to find a pharmacy that's going to watch that for you. And I think,
please be aware of it, because here we are thinking, oh, we're doing so wonderful. We're having soy, but soy is highly contaminated. So
I would make sure that whoever your practitioner is, that they're using a pharmacy, Pure Pharmacy in Carmel, Indiana. I prefer her just because I know she's going to appropriately dose and, use proper ingredients for anything that we're doing. And she's just passionate about it and very careful. And I know there's some here locally too, Lily. You have a supporter that's very good at that. Just try to work with whoever your provider is and make sure they're using a good pharmacy that's conscious of those things.
Yes. And speaking of which, the pharmacy, thank you for bringing up my wonderful sponsors. The pharmacy is a sponsor of the Lillian McDermott radio show Classroom, and they do creams, and they have been working with Lisa. Lisa works with great companies, and I'm so grateful that she's willing to work with the pharmacy, because they are wonderful. I want to say something. This is a very sensitive topic. A lot of people don't want people to know that their hormones are out of balance. So this is kind of like a shame. It goes with shame because we don't understand the behaviors of the body, and then we blame and blame the mind, or blame the blame, shame, guilt mindset starts building. So if you have any questions for Lisa, or a question that you would like asked, please feel free to text me if you don't want to put it on the group text or the comments below. So you can text me at 407-373-5959. That's 407-373-5959. My number is on my Facebook page. I don't believe it's on YouTube. It might be, but you can get a hold of us. Just text us and say, this is my question, and I will read it on the air. Okay. So with that in mind, you had mentioned if somebody has 253, and they'll consider they're still in the normal range, but what if they're 450 and they're still having these symptoms? Then what?
We have always preferred to see that testosterone around 800 to 900. That's what we see where men are optimal. But I'm going to say this again. It's personalized. You might have somebody at 500 and they feel awesome. I'll never forget years ago. Oh my gosh, this was maybe in 2002, 2000. We had a patient, and he was just a mess. And we started him on testosterone therapy. It was bioidentical. He had DHEA and testosterone. And we did, we'll talk about this in a minute. We put him on a little bit of DIM, and there's a reason for that. I'll explain that in a minute. But he ran into me in the parking lot on his way into the office, and he took his shirt off, and he was prancing around showing me his six pack. And he said, testosterone, oh my God. He was just in heaven. So, it can make such a difference in a man's life. And, having said it, you got to be careful not to go too high either. If someone comes in and they have a testosterone of 1200 and, and they've got some red blood cells that are out of balance, we've got to look at that too, and you need to address it. So, when we see men that have to bloodlet or give blood regularly, we don't like that. That's not good. That's not normal. Having a healthy testosterone, is better, but there are optimal ranges that you want to look for. Mm-hmm. And, men can convert testosterone to estrogen, and that can be really bad. And we see that in men who are balding. Not that that's the only reason, but it can contribute.
All the guys went, oh no, I'm running. Live Longer Medical.
So, it's just a sign, it's just part of the symptoms.
How can you tell? Is it blood work? Is there
estrogen? Yeah. You look at their estrogen levels and see if their estrogen is high, then you need to kind of, they're converting. And so some men just have a propensity to convert. And so we'll give them DIM. DIM is, it's a natural supplement that helps balance estrogens. I take it just because it keeps my estrogen balanced. I take a lot of things to keep my estrogen under control, so I'm not grouchy, because women can get grouchy too. So at any rate, I want to stay happy all the time. But, it's a phytonutrient. It comes from things like broccoli, cauliflower, Brussels sprouts, kale. It's a natural supplement that just helps balance those estrogens. And I think men need to know their testosterone, their DHEA, and their estrogen. They need to know those levels, and then they can more effectively work on what they need personally. So
awesome.
It's kind of an important piece.
Awesome. And before I start talking about absorption, because you guys can give as much as you want, but if the body's not absorbing it, then that's a totally different thing. So I do want to ask for all of you to work here with me. So as you know, the classroom has been targeted, and I need all of you to congratulate my sponsors. I want all of you to go to whenyouneedafriend.com. We are making the website stronger, so it will be ready. If something happens, we will be ready to continue and move on. So this is what I need for you to do. Go to whenyouneedafriend.com, because you get notices, and you will find out before anybody else who's the teacher in the classroom. And you also get lots of free gifts, and you'll be the first one to be notified of that. You'll be the first one to get whenever the class is done, you'll be the first one to get it, right? So that you can listen to it whenever you want. So go to whenyouneedafriend.com, please become a subscriber. And when you're there at the site, make sure you scroll down to my sponsors page and check out my sponsors like Nori. Speak of broccoli, I've been bragging about this supplement, Lisa. It's broccoli and radish sprouts, and it's sublingual.
Oh.
and it's by Nori Nutrition.
Oh, that sounds awesome.
It is awesome. I always feel good whenever I put some, and it's sublingual, so it dissolves in your mouth. This is just one of many supplements that Nori Nutraceutical, that's Nutritional Oncology Research Institute. Keep Me Safe Organics. They're going to be in the classroom tomorrow. And there's always some giveaways when they're in the classroom. First Alternative Care, telemedicine, the pharmacy. We talked about the pharmacy just a little while ago. All of these, if you mention my name, Lily 10, you get 10% off or 20% off at the pharmacy. Live Longer Medical. We love Live Longer Medical and the wisdom that Lisa brings to the practice. And I'm just looking forward to going to see her tomorrow to get my IV treatment and get some other stuff too. And of course, remember my sponsors and figure out a way that you can support the sponsors the way that they're supporting the classroom. But here, we're not done yet. We have my affiliate page, my little shop now bag. So that's ground therapy and brain tap. There are some, if you want to get grounded, that's where you go, ground therapy. But make sure you text me because I want to make sure that you get a special gift. And the other one is brain tap. Oh, when I say text me, let me know that you purchased. Brain tap, there's a 15-day free trial. So take advantage of these things. And this is another way you can support the classroom. And so become an enrolled student. So figure out ways that you can help out you who are getting this free programming that costs quite a bit. And you can be a part of the growth of it, whether it's $1 or $1,000 a month. Please be part of the growth of the classroom. And today we are talking to Lisa Geyer of Live Longer Medical. And for those of you who know, you can call Live Longer Medical at 321-327-2980, or you can go to livelongermedical.com. If that's too long to remember, just go to whenyouneedafriend.com and click on the Live Longer Medical logo, and it'll take you straight there. I don't care how you get there when you can. And so they're in Indy Atlantic, Florida. They're absolutely phenomenal. I love spending time with them, and I love spending time with Lisa. So that always helps. And so I appreciate you, Lisa, for always coming on and sharing your wisdom and seeing how your practice is changing since COVID, pre-COVID, and now all the different changes that you guys have made. Is there anything in particular that you want to share that's been a highlight after this experience with COVID?
Wow. You know, you learn a lot going through COVID. It was an interesting time to really, really introspectively look at what you're doing in your personal life and in your work. But I want to rewind 2 seconds and say this. One of the things you do when you go onto your site and you click to be reminded when you have a show coming on, I did that, which is very cool because I don't always know when you have something happening, and it's wonderful to be able to join in, and I can't keep up when it all is. So sometimes I'll get this little ding on my phone, and it's great because I'll be putting my makeup on and I'll think, oh, cool, I can do that while I'm doing my makeup and listen, and then you don't miss something. So it's kind of cool. But anyway, I thought I'd throw that out there. It's a great little feature.
And when you are part of your website and when you're a part of a member in your clinic, they get notifications when you're on. And I got one this morning.
Yay.
Lisa Geyer is going to be in the Lillian McDermott radio show classroom. So that's good. There's so many, you see, we got to set ourselves up for success. Crap is going to happen. Things are going to happen, but we have to and get to look at the brighter side. Everything has purpose. And if we don't look at the purpose, then we will become bitter with a poison. So when you don't understand that there might be something else that's happening, and we just try to blame ourselves for not having enough motivation, or not wanting to go to the party, or not wanting to get out of bed. There are so many other ways that you can become your own MD, become your own medical detective and say, I had my blood work, and which is a follow-up question. You say, what is a good blood work to do? You said full panel. What is that called?
Well, again, it's different for women and men, but
let's talk specifically for
men. It's free testosterone, total testosterone, estradiol, and we like to do a nice panel on the thyroid, like a T4, T3, reverse T3, TSH, and a thyroid antibody. We like to look at a nice full package like that, and we always do the basics like a CBC and things of that nature. So we give it a full look, and then if we're meeting with someone, they might mention, gee, I feel this or I feel that. We have seen a huge increase since COVID, since we talked about COVID a minute ago, of people, because they stayed home and they were cooking so much, they had an increase of sweets. And I cannot tell you how many people have been telling us lately, they're craving sweets, they're craving carbs. And there's just a real
addiction.
Yeast.
It's an addiction.
It's an addiction, but it's causing yeast overgrowth. And I had that myself, just having to deal with that. And address it. So, then I spoke to a couple of other doctors this week who said they've got the same thing going on with their patients. So, it's interesting when you are quarantined and all you have to do is, I guess, cook. I mean, I did a lot of reading. I took 2 courses from Yale University, one on biochemistry and one in the happiness program they have. It's pretty cool. So, you can choose to use your time wisely and do something effective. But, for a lot of people, they just sat around and I guess ate. And
drank, because
and probably
drinking
drank
alcohol is essential.
Yeah, I think we did see a lot of that.
Yeah.
But it's you kind of have to come out of it and kind of wake up again and look at your patterns. And if you're starting to get into a pattern that could spiral into something very negative, pull yourself out of it or get someone to help you get out of it, and make sure you do know what your levels are, because when you've been quarantined and you can't get the things you normally would have, whether it's your supplements, we have full script on our website. So all of my patients could click on the link, order their supplements and get what they needed through the entire process, and they can continue to do it. But one of the adaptations that we had during COVID is we started telemedicine, and we're continuing it because people are begging for it. They love it. Mm-hmm. So, it's funny, when I bought the clinic, people complained because they had to do more telemedicine visits. Well, now they want it. So it's kind of funny, but it's a balance of what we offer to people and meet them where they are.
Very good. Very good. Now, another thing that you said earlier, I've got all these follow-up questions.
That's okay.
You said that men get menopause, and that should be men should be called menopause, and women should be, womenopause or something, maybe the andropause for women, menopause for men. But, I'm not going to reinvent the English language. Yeah. But you mentioned that, we did a class, when we went to see the menopause, the movie, the play Menopause. We went to see it. Yeah. And we decided we were inspired to do a class on that. But do men have some of the symptoms that women have, like hot flashes?
Oh, yes. It's on my list. Yes, they have hot flashes.
So what are some of the other symptoms that?
Well, there's a bunch. You can have sleep disturbance. You can have hot flashes, weight. It can affect your heart, mood, libido, bone density, energy, stamina. There's just, if you have any of this stuff going on, it's something to look at for men. It's very similar to women. Women have that. We can get moody. We can gain weight. I call it hormone weight, lack of hormone weight. Muscle integrity is huge for men. It's also true with women too. Women have said, I can't work out anymore. I don't lose weight. When I work out, it doesn't improve anything. I've had several women lately that I've recommended Pilates because, we lose our core, I think, when your hormones are out of balance. So I think Pilates is just a wonderful thing for building your core. Mm-hmm. For me, I've been cycling 5 to 10 miles several times a week, and that helps me. I have a good friend that told me the other day when she came in to get her IV that she's doing 30 miles. And I said, oh, gee, I guess I'll have to step up my game a bit. But, it's good to try to improve and increase what we're doing. But I've just noticed just cycling, my core is getting stronger. So whether it's walking on the beach, running, cycling, tennis, it really make a difference. But if your hormones are off, it's harder. I can just tell you it's much harder.
Okay, so that's a great segue into the next, because another follow-up question is, you talked about yeast overgrowth, and that a lot of people have been consuming a lot of alcohol, a lot of sugar, a lot of processed foods, which leads to yeast overgrowth, candida. We hear it all the time. Many of us should be looking at that. Is there a test to see if you have candida?
Yeah, there's several different modalities for testing that. You can do a blood test. There's also, I think, probably one of the best, which most people don't like it, but it's a stool test. Genova makes it. And it's a good one just to get a very clear, what comes in or what's going in is coming out. So if you could kind of look at how you're processing your foods, it'll tell you a little bit about your digestion. And as we know, all immunity comes from the gut. So if you have a healthy gut, that will filter into all the other areas of your body, and how you process things, how you filter it is vitally important too. Again, we are what we eat. So, I think knowing if you've got the symptoms of yeast,
Which are?
Well, it can be a lot of things. A white coated tongue, craving sweets, craving carbs, a yeast infection. Women can have a vaginal yeast infection.
Men can get it too.
Oh, yes. They can have it on their skin. It'll come out in their skin in different rashes and different things that they can get. Athlete's foot. There's lots of
fungal nails, the fungus
fungal
growing on the
nails.
nails. Yeah. On their toes, on their hands. I mean, when I see people that have funguses growing on their toenails or their nails and their hands, I just want to just say, do you know you have candida? It's like, but I'm not a doctor. I just play one on TV.
Well, and it can, cause bad breath. It causes body odor. So I mean, it's really nasty. And so you want to get it under control.
Yeah. And yeast has candida has a purpose, which is to dissolve the body when it's dead. That is the purpose of candida. It just will eat you up so that you can decompose, so the body will decompose. Yeah, I know. Enjoy that visual. But here's the thing. If you're still alive, you don't want that to take over, because the more candida you have, the more you will be eaten from the inside from these little bugs. So with that in mind, will that cause a lack of absorption? So if somebody's using creams, because you talked about creams, that's an option, but can creams be malabsorbed if there's yeast overgrowth?
Good question. I don't really know the answer to that question.
Okay.
I will say this, anything that is troubling your body's abilities to process is a problem. And yes, candida causes that. There's a wonderful book called The Yeast Connection by Dr. William Crook. And years ago, that was my Bible, because he has so much wisdom in that book. I don't know if he's still alive, but it's a wonderful, wonderful book if it's still around. Jacob Teitelbaum. I just love it.
He's been in the classroom many times. Yeah.
He's great. And he was just at APRN, I think 2 years ago. And we took a picture at his booth, and he was handing out books. And what a very happy man. He's really made a difference in so many lives. And From Fatigue to Fantastic was his book. But, he talks a bit about that. So, there's a lot of wisdom out there. I keep going back to this, but you need a well-rounded practitioner. It's going to listen to your symptoms. And, we used to say, if you listen long enough, a patient will tell you what they need. Mm-hmm. Chronic fatigue patients will say, gee, I had a flu I never got over. Or, men will come in and say, I can't work out in the gym anymore. Mm-hmm. I don't get anywhere with it. So, there's just all these things that you need to look at. And for men, if they get their testosterone in order, it will increase their rate of dying from any of the terrible diseases by 56%.
Wow.
And so it's really important. And they'll decrease their probability of having a heart attack by 24%. So there's things that you want to look at that could change your outcomes and make you more viable and vibrant. You don't want to be 100 and living horribly and miserably, but you also don't want to be 30 and living that way. That's so take the time, when you're young, know what your levels are when you're young. And if you don't know them and you're in your 20s, go find out, know your levels and monitor that. Get a baseline and keep an eye on that through your life and watch what you're doing. And of course, we preach healthy eating because it does start there. And exposures, heavy metals. You asked about hormones. If you have heavy metals, you are going to have a sluggish ability to process many things, but not to mention hormones. Yeah. So, those are things that can affect the way you process your hormones too.
Well, I tell you what, this has been a really great conversation, but we're going to take this after with the teacher's pets. And for those of you who have been watching, let us know where you're watching from, because we can't tell unless you write something. So thank you, Norm and Victoria for letting us know that you're sitting in the front row in the classroom. all of you know that we're always willing to answer any of your questions. If you have any ideas or any questions that you would like for me to ask Lisa, you can send them to me ahead of time, or any of the teachers in the classroom. But it's time for us to make these decisions that we're going to take our health back. And we can start by reaching out to Live Longer Medical in India Atlantic. It's 321-327-2980. Call today, because you may not have tomorrow. So call right now, because we keep just putting it off, kicking the can. And the longer we wait, the bigger the problem. That sack of potato now is going to start sprouting other things to make the bag a little heavier. So make sure you take care of yourself. And we're going to continue our conversation. So for those of you who are on podcast and you're listening on podcast, just know that you can join us. It's a little bit longer on YouTube and BitChute. And make sure you like us and follow us. Share this with everybody that you love. Please remember, we'll be right here waiting for you. We're going to continue our conversation with the teacher's pets. Please know we'll be waiting right here for you. This is Lillian McDermott wishing you love, peace, joy, and Lisa Geyer wishing you love, peace, joy, and unexpected abundance. Make it the best day ever. Oh, this topic just made me verklempt. There we go.
The opinions and advice expressed on the Lillian McDermott radio show are intended for the individual callers and guests on the program and are presented to our wider audience solely for general educational purposes. Please act responsibly and consult personally with your own medical, psychological, or nutritional expert before taking any steps to improve your life.
Okay, Lisa, I have some questions more because I knew this would go into a lot of depth. Did you hear I noticed that my microphone wasn't unmuted. Did you hear me? Did I start speaking before my microphone was unmuted?
I hear you just fine, but mine automatically muted for some reason.
Yeah, it's been doing that today. It's been like crazy.
It's okay, I fixed it. Yeah,
okay.
It's good.
Okay, for those of you who are still watching, and I would love to see where you're from. Just write a comment. And if you're watching on YouTube, we love your comments as well. So I want to talk to you about, now that this may not be safe for the little ears, so it's up to you. If you're a parent that welcomes these conversations, go ahead. But on Tuesday, we had Mark Simon of Nori Nutraceuticals on, and a gentleman wrote that there was an article that was read. I haven't read the article, so I'm just saying the question, that to have a healthy prostate, to keep from cancer, to keep from, problems with the prostate, that men should ejaculate 21 times a month. Have you read that article? I need to go back because I think
men would love that.
Would they now? Would they? Okay.
Well, some, if they have a healthy testosterone level, they might love that.
I bet you a bunch of guys got together and said, how can we get our wives to be intimate with us, right? So let's write this article. I don't know. It sounded, I've heard that couples that have intimacy twice or more stay younger and connected, and there's like some healthier, there's some biochemistry that goes on during that, but the less you use it, the more you lose it. Yeah. So that's so important. So I remember, gosh, this is now going back to 2017 when I had when I started in Jacksonville on the radio show, in WWBC, WBOB and the Biz in Jacksonville. But I had, his name is Gil Weiss, Dr. Gil Weiss. He's a pharmacist, but he has changed the way that pharmacy is done. He was the one that showed me that pharmacists have a license to distribute poison. to dispense poison. It's written in their license. It says, they're authorized to dispense.
Well, there's probably a lot of medications I would call poison.
Well, they have
Yeah.
a license to dispense poison.
Yeah.
So he said that one of the biggest cause, because we're talking about the cause, the root cause, he said is too much animal consumption causes cholesterol to malfunction. Now, high cholesterol, when it's done with plant-based and some animal-based, it all depends on the ratio. It all depends. He says that it's good to have cholesterol, that testosterone comes from cholesterol.
Mm-hmm. Right.
Can you expand a little on that so that,
well,
and if you can't, that's fine too, because
cholesterol's tricky because some people just genetically are predisposed to have high cholesterol, but the levels you're talking about are HDL and LDL.
yes.
And I can't remember the ranges, but you think of HDL as high like heaven and LDL as low like, hell.
Heck.
So that's kind of how you think about it. So
Mhm.
if, you do want to know those levels too. I mean, that's going to affect everything as far as your hormones are concerned. So, knowing that is vitally important. I don't know the biochemistry of what that would look like if your cholesterol is this level and your testosterone is this level. So I couldn't answer that question. I know that they are all an important piece.
Yeah. Well, I know that we discussed it, but it's been a while since then. But for those of you who want to learn about the cholesterol and how it gets testosterone flowing properly, and there's a lot of animal consumption, and that can lead to a lot of other issues. When the animal consumption is way out of balance without having the vegetable consumption,
Right.
that can create a problem there too in the hormones. So there's so much we don't know. And just being curious and saying, let me dive into this or let me dive into that. It's amazing what you can discover that will be highlighted for you. Then the next thing I wanted to talk to you was the side effects. You talked about some of the men that are doing the injectables.
Yeah, we probably didn't hit that hard enough. I mean, men could get male boobs from taking too high of a dose.
Isn't there a technical term for that?
Yeah, gyno something. I don't remember. Yeah, I mean, it's kind of what you read. Of course they can. I mean, you can have, it can cause issues that, like I said, just the polycythemia, when your red blood cells are too high and you have to go give blood to bring that down, your blood gets thick from that, and that's not good. So,
and then they put you on blood thinners, and then they keep giving you medication after medication. The next thing you know,
you want to live your life as naturally as you possibly can and give your body all that you can, the way God gave it to us. Certainly there are times in people's lives where they've made a left turn or a right turn, and it's caused them some issues that they have to deal with. And it might be because they've got to take an antibiotic for a short time, but make sure that you're going to have to take a probiotic with it. I mean, there's all these things in our lives that we have to address in different ways, and we want to get back on the right track. And I know in my own life, I've gone through things that I have to make decisions how I'm going to change how I feel. I went through a weird period of joint pain in the morning, and just figured out I wasn't getting the right nutrients and supplements. Changed that, and it's gone. Literally in a week. So there's just but you have to understand how to look for that root cause too.
Yeah. So if a man has an enlarged prostate, could it be from too little testosterone?
Yeah, they should look at their testosterone levels. And that's what Dr. Morgenthaler's been doing. I think he's chief urologist actually at Harvard. So he's quite an expert. And I know he's 4 years into his study, at least 4 years, might be longer now. But last time I read up on him, he really was doing some great work. So it's somebody to read about and study. And, we're so fortunate to have so many great physicians who are great biochemists, and they can put all this together. And I feel really grateful. I have 2 amazing nurse practitioners right now, and they're very ethical and they're appropriate. And I just love Amanda. She's, been with me for several months now, and she's just very appropriate in how she manages some of this hormonal stuff. Because, we've had some men that they get on that testosterone and it's like a high. And, they have to be careful not to be too high with it, because that can also be a problem. And so I think certainly, we try to listen and pay attention, look at symptoms, look at labs, and be detailed, as everybody should be.
So we talked about testosterone and a little bit of DHA. And by the way, let us know where you're from. We're talking with Lisa Geyer. If you're just tuning in, we're talking with Lisa Geyer of Live Longer Medical about men's hormones, the good, the bad, and the ugly. And since we are talking about men's hormones, we talked about testosterone. What other hormones will men, because we look at estrogen, we look at progesterone, we look at estradiol, we look at, testosterone. What are some of the hormones that men have other than testosterone?
Well, you do have to look at their estrogen too, because their testosterone could be over converting, and you have to address that. And again, that's why if we have men on testosterone, we like to have them on DIM. It's a wonderful product. And, there's several companies that make it, some better than others. Please don't buy your supplements at,
Other places.
Yeah. You want to make sure it's pharmaceutical grade.
And they can go onto your website and get some.
If you go onto Full Script on our website, there's a store there. You can get those products there. We have them in our office too. And, some people are coming in. I've shipped a few things out when patients just called and said, I need this. So, we're doing things like that to help. But yeah, DIM is a really, really great supplement. I really like it for myself personally. It just reduces, the risk for having hormones out of balance. And I do take it. So, yeah.
Well, so testosterone and estrogen are the 2 main hormones for
right.
men.
And DHEA is awesome to know about, because it's kind of that anti-aging marker. And DHEA is like a boost for testosterone. We've had women that, we just give them DHEA and it will increase their testosterone level beautifully. Some people are ultra sensitive. I happen to be one of them. If the bottle says take 2, I can take half of one. And my body does well with it. So I methylate and process really well. But
any other one that we need to be?
We like to look at thyroid. When we're looking at a man, we look at all those thyroid levels. Those are really important too. We always look at their PSA. We always do a good CBC panel. We just want to, know what all those things are looking like. I think it tells you a lot about, the man and how he's already processing things. But, sometimes for men, those symptoms speak really volumes.
Very good.
Yeah.
Anything upcoming that you want to share? Something that we have not spoken about yet?
I to mention for the month of June, we have a new amazing young man. He's a paramedic. When I interviewed him, he said, yeah, I do those IVs going over railroad tracks. And I said, you're hired. So anyway, he's amazing and smart and loves what he does. And he's new in our office. He has lots of flexibility. And over time, patients will just be able to text him and say, hey, I want an IV. And he'll meet him at the office and give them their IV.
Now you have some new hours for IV therapy. I'm going to go there tomorrow to have some IV therapy with you. Yay. So that I can boost my immune system and start feeling better. And so anything else that you want to share? That's
IVs are $50 off in June. I think we're going to extend it through July because people are loving it. So I think we're going to do that. And then, come in and meet Patrick Milbacher, our new paramedic IV therapist. He's just great. And he's also going to be working with Tina on our erectile dysfunction treatments when we start doing that. It's a wave therapy, which we'll talk about.
And is that the P shot?
We also, Tina does do a P shot, and it's, it's a tough one. Hope there's no kids listening, but yeah, it is, it's for men.
Well, you know what, if they go to the 2 months ago, we did a class on that. We did the O shot and the P shot. And if you want to learn about it, you can go there. Because I know that you've got to get to work today.
I do.
Yes, but there's a question from Kimberly. She says, what product does she use for low thyroid?
Wow. I love that question. Yesterday, we had a call from a patient on his Armor Thyroid. Armor Thyroid is a very old-timey medication, and it's more natural. We also use Nature-Throid, Westroid.
That's what I use.
Yeah, and I think we use as natural as possible. So, quite honestly, if people don't do well with Armor Thyroid, we'll switch them to Nature-Throid or Westroid. MP Thyroid also is very good. We like it as well. Our rep was just in yesterday and gave me a bunch of samples. So when people want to try it and see how they feel on it, we can give them free samples. So, we don't like the synthetics. And also, I will be honest with you, some people with their thyroid, they might need a little more T4 that converts to T3. And so you can have that compounded. A good compounding pharmacy can compound thyroid medication specifically to you. So I think that's an important piece.
Yes. So I want to thank all you students in the classroom, your teacher's pet sitting in the front row, Norm, Victoria, Myrna, Kimberly. I want to keep encouraging you to show up and state that you are sitting in the classroom, because we can't see you otherwise. And it's always good to know that we're in this together. It's always good to know that someone is out there learning new truths with me, because, I'm a student along with you. I just happen to be in the front row all the time. If the classroom is in session, I've already taken my seat. So I want all of you to claim your seat. I want to encourage you to join the Heal Tribe. We had an incredible conversation on Monday. And Lisa, I'm so sorry I did not send you the link, did I? So I take full ownership of that one. So Dr. Joel Furman came and spoke to the class, our group, and we have now relaunched the Heal Tribe. So for those of you, and we encourage you to eat a nutritarian or a low animal products, but mostly plant-based, whole food plant-based. So nutritarian, and take your pictures, share your recipes. And we have relaunched it after we did the infection protection 20 from transformation with Dr. Furman. And so we just want to remember how important good nutrition is to keeping our hormones balanced. Is there anything you'd like to add, Lisa, about good nutrition for that?
I think it is just a reminder that when I meet with our patients, I always tell them that I like to see them getting 8 fruits and vegetables a day. And they usually faint. They're like, oh my God, there's no possible way I could do that. But, honestly, it's really about, it's a half cup serving. And if you just have a salad, who eats a half cup of salad? So it's not as hard as you think. But it is getting all those nutrients, and organic is always best. I like to see our patients doing that. And a friend of mine sent me a really cool quote today, and it was Deepak Chopra's, and I'll close with this. And it says, because I always have a choice, I choose love. So I think when we deal with our patients, I've always told my staff, people don't care what you know till they know you care. So if you can just start your day with that, and start your day with that grateful attitude, and work on your health, maybe one piece at a time. It is a puzzle. You'll get there.
Yeah. So along with that, we're always in choice. We can choose what we don't want and focus on what we don't want, or we can choose what we want. Either way, it's a choice. We're always in choice. And if we choose love and we fail, at least we loved, because
That's
love
right.
increases every single bit of that energy and frequency in our body, so that the person who is in fear or in hate back at you, you'll have your cloak and shield to protect you. It's that
Right.
armor of protection that we read about in Ephesians. So I want to thank you all for being in the classroom today. Please always send us some love. We love the love. Please share this and help us grow the classroom. And remember to reach out to Lisa, because Lisa is there for you as well. You can call 321 327-2980. Remember, you can go to Live Longer Medical, or you can go to whenyouneedafriend.com. After you subscribe, check out the sponsors page, and the Live Longer Medical logo is right there. So we'll see you soon. Say
Take
goodbye,
care.
Lisa.